Hello everyone, I am Dr. Rebaz Samir. Today we are going to explain something really important, which is the muscles of mastication. Before starting, it is very important to recognize some landmarks. For example, here we have the temporal lines, which is located on the lateral surface of the skull, and here we have the zygomatic arch, which is the attachment site for one of the muscles of mastication, which is the masseter muscle. And between the temporal lines and the zygomatic arch, we have a fossa. We called it temporal fossa, and on this temporal fossa we have this muscle, which is the temporalis muscle. It is another muscle of mastication. If you go inferiorly, we have another fossa. We call it infratemporal fossa. It means inferior to the temporal fossa. That's why we call it infratemporal fossa. And regarding its boundary, anteriorly we have the tuberosity of maxilla, and posteriorly we have the styloid process of the temporal bone. And the most important thing, it is the lateral trigoid plate of the sphenoid bone. Here we have the lateral trigoid plate, which has two surfaces, lateral surface and medial surface. So the lateral trigoid plate, again, it is the attachment. It serves as an attachment site for the another muscles of mastication, which are trigoid muscles. I mean the medial trigoid muscle and the lateral trigoid muscle. For example, here we have the lateral trigoid muscle attached to the lateral surface of this plate, and medial trigoid muscle attached to the medial surface. Of course, here this plate has two surfaces. The one that near to the midline we call medial surface, and this one that we can see it clearly is the lateral surface. Alright, we all know that we have four main muscles of mastication. We have the temporalis muscle, masseter, medial trigoid, and lateral trigoid muscle. First, we'll start with the temporalis muscle. Here we can see that this muscle located or started on the temporal fossa, and if we hide or remove the zygomatic arch in order to better see the fibers of the, or we can see the insertion site of the temporalis muscle. Here now it's clear that's attached to the coronoid process. You know that this process of mandible we call coronoid process of the mandible, and here it's condyle, but the temporalis muscle attached to the coronoid process and some fibers attached to the anterior border of the ramus of the mandible. For its function, the temporalis muscle responsible for closing the mouth. Here we can see by action of this muscle cause elevating the mandible. The second function, especially by the action of the posterior fibers of the temporalis muscle responsible for retracting the mandible. Here we can see retracting the mandible, moving the mandible backward. Now if we go to the second muscle, which is the masseter muscle, it is clear. Here we can see it is the second muscles of mastication, consists of two parts. Here we call a superficial part, and another one we call a deep part according to its location, and it's clear this one superficial and deep part. So they originated from the zygomatic arch and inserted to the outer surface of the ramus of the mandible. For its function, before showing you this animation, it's clear. Imagine that by contracting of this muscle, what happened to the mandible? Of course, by contracting, closing the mandible. Here, by the action of the superficial fibers, closing or elevating the mandible, and by the action of the deep fibers with the help of the temporalis muscle responsible for retracting the mandible. So we can say that the temporalis and masseter muscle have the same function, which are closing the mouth and also retracting the mandible. So the third muscle is the medial trigoid muscle. Here, medial trigoid muscle. Now it is a little bit hard. We cannot see the medial trigoid muscle clearly. It is better if you fade the mandible. Now it's clear. If you remember from the first slide, I told you the medial trigoid muscle originated from the lateral trigoid plate, but on the medial surface. And here it is clear again inserted on the surface of the ramus of the mandible, but on the inner surface, not the outer surface, because on the outer surface you have the masseter muscle, but medial pterygoid muscle is attached to the inner surface of the ramus of the mandible. Another view, it's clear, the posterior view, you can see that originated from the medial surface of the lateral pterygoid plate. And here, after putting back the mandible, here we can see that's attached to the ramus, but on the inner surface of the ramus of the mandible. For its function, just like the masseter and temporalis muscle, again this muscle responsible for elevating and closing the mouth. Another function, we have two other functions. The medial pterygoid muscle is the protruding the mandible, here protruding, unlike others, because the masseter and temporalis responsible for retracting the mandible, but the pterygoid muscles, both medial and lateral pterygoid muscle, responsible for forward movement of the mandible. Now it's clear. And the second, another function that it has is the lateral movement of the mandible. So here we can see by the action of this muscle goes moving the mandible to the other side, or we can see side to side movement. So these two function, protrusion and side to side or lateral movement of the mandible, are shared with the lateral pterygoid muscle. So medial pterygoid muscle has three functions. One of it is the closing the mouth, just like the masseter and temporalis muscle, but two other functions, just like the lateral pterygoid muscle, for protrusion and side to side movement of the mandible. So the last muscle is the lateral pterygoid muscle. Here we can see, for the origin it's unclear because it's covered by the mandible, we cannot see it, but for insertion this muscle is clear, attached to the condyle and articular capsule of the temporomandibular joint. Here it's clear, attached to the condyle of the mandible. If we remove the mandible to better see the origin side, here it's clear the lateral pterygoid muscle has two parts or two group of fibers. One of them we call superior head, based on their location. It's easy, really. Superior head, of course, this one become inferior head. Now the superior head originated from the greater wing of the sphenoid bone, and the inferior head here from the lateral pterygoid plate, but on the lateral surface of this plate, and as I told you, inserted to the condyle of the mandible. For its function, it's unique. Now the lateral pterygoid muscle is the only muscle for opening the mouth here, or we can say depressing the mandible, okay, unlike other muscles. For example, masseter, temporalis and medial pterygoid muscle are responsible for closing, but here we have the lateral pterygoid muscle for opening. And it is clear, when you say that by the action of this muscle, it means pulling the condyle forward or anteriorly, and it's easy and it's clear. By pulling it, of course, automatically cause opening the mouth or depressing the mandible. And if you remember that I told you, the lateral pterygoid muscle, just like the medial pterygoid muscle, responsible for forward movement of the mandible here, and another shared function with the medial pterygoid is the side to side or lateral movement of the mandible. Okay, another thing we want to share with you, as I told you, the lateral pterygoid muscle is the only muscle responsible for the opening of the mouth. Maybe somebody says that why we need three pairs of muscle for closing the mouth while only one muscle for opening the mouth. And the reason is clear. Of course, for opening the mouth it is easy by the action of the gravity, but for closing the mouth, especially during chewing and cutting the foods, of course we need the force, more energy. That's why we need more action of the muscles. That's why we have three pairs that God created us like this, and for opening, and it's easy by the action of the gravity, and it doesn't need full or more energy. Of course, it's easy. But the last thing is related to the condition we call the trismus. But before sharing with you what's trismus and the signs, symptoms, and the causes with the treatment, I want to tell you that there is a normal distance between the upper anterior teeth and the lower anterior teeth. This distance we call interincisal distance. Inter, it means between, incisal, between the upper and the lower incisal distance. This distance in normal or in average should be 40 millimeter. And another measurement we have distance with lateral movement of the mandible from the midline to the most lateral side or lateral point of the mandible should be 10 millimeter. Of course we have variation, and another movement forward or protruding of the mandible we can move until 10 millimeter. So this measurement, of course, plus minus 1 or 2 millimeters, it's normal. Now we have a condition or another easy technique and workable we can evaluate. Maybe it is a little bit hard for checking by, of course we have the rulers and it is easy, but it's the easiest technique. We can insert these 3 fingers between the upper and the lower teeth, and this distance should be equal to the width of these fingers, and of course we should wear the gloves, not like this. Okay, let me tell you that what is the trismus. It is trismus, it means like this: the patient is unable to open the mouth fully, and of course it interferes with the patient, of course, has pain and interfere with the talking and eating during or chewing during eating. The patient faces difficulty. And for the reasons and the cause, we can say we have many causes, but one of the causes is infection, especially in cases of the pericoronitis. It means inflammation of the soft tissue around the partially impacted lower third molar. Sometimes this infection spreads to the other sites, for example near to the masseter muscle or medial trigoid muscle, directly affects these muscles, and the patient complains of trismus. And also maybe by accident, car accident, any trauma to or damage to the muscles of mastication, again the patient complains of trismus. The patient cannot open the mouth widely. And the most common one that happens many times in the dental office is after doing a long procedure. Sometimes, for example, root canal treatment takes long time, and some other surgery needs time. After finishing, the patient complains and cause spasm of this muscle, and again the patient experiences of the trismus. For treatment, actually depend on the underlying cause, but here in order to remove this spasm we can prescribe muscle relaxant, and since the patient has pain, that's why we need to prescribe analgesic. But another easy technique we should use is the inserting the tongue depressor into the patient's mouth as much as we can until mild stretching sensation is felt. So we should advise the patient for the tomorrow add 1 more tongue depressor, and so on, like this. And the patient should repeat these procedures 3 to 4 times per day and 3 to 4 times per session until we gradually reduce this stiffness of the muscles of the mastication. Guys, thanks for watching. If you found that this video is helpful, please share with your friends, and see you in the next video.